Welcome back, guys. Now let's discuss about the phases of cardiac cycle. Okay, now the entire cardiac cycle is divided into two phases. What are they? Systole. Systole means contraction. Okay, contraction. And diastole. Diastole means relaxation. Now itself I am telling you, see, systole means we are mainly concerned about the activity of the ventricles, not the atria. Okay, so ventricle is the most important part. In the cardiac cycle, when I am discussing about the systole, I am mainly talking about the ventricles. Okay, not the atrial systole. Actually, atrial systole or atrial contraction is happening during diastole of the ventricles. Okay, don't worry, it will be very easy for you. What I am saying is, cardiac cycle is divided into how many phases? Systole as well as diastole. During systole means contraction. Which contraction? Ventricular contraction. Okay, during systole, what are the events happening? How many, the systole is divided into how many phases? Systole is divided into three phases, which includes isovolumetric contraction, rapid ejection phase, and slow ejection phase. Now tell with me, systole is divided into how many phases? Isovolumetric contraction, rapid ejection phase, slow ejection phase. Now in the same way, diastole is divided into 5 phases. Okay, diastole is divided into how many phases? 5 phases. What are those 5 phases? Protodiastole, isovolumetric relaxation, rapid ventricular filling, reduced ventricular filling, which is also called as diastasis, and atrial contraction. Remember, the important point is atrial systole or atrial contraction is happening during diastole. Atrial systole is a phase of diastole. Okay, now having said this, now let's start our topic with the event of atrial contraction. First, let's start with the atrial contraction, guys. Okay, first atria are contracting. Now what will happen? See, now let's start from here. Okay, the first event, let's take the first event, that's the atrial systole. Now what is happening during atrial systole? Atria are contracting. See, when atria are contracting, just think logically, blood have to move from the atria to ventricles. When atria are contracting, blood will move from atria into the ventricles. Now tell me, if blood is moving from the atria into ventricles, what is the status of atrioventricular valves? What is the status of mitral and tricuspid valve? They should be open, then only blood will move. So please look at here, during atrial systole, now see, as I am keeping plus symbol here, plus means contraction. Atria are contracting, mitral valve and tricuspid valve, they are open, and blood is falling down into the ventricles. How much blood is coming? How much percentage of blood is coming? Only 30%, which means already 70% is there inside the ventricles. Later I will explain you from where that 70% came. But right now, because of atrial contraction, how much percent of ventricular filling is happening? 30% of ventricular filling is happening. Okay, so atrial systole, or which is also called as atrial kick, contribute to 30% filling of ventricles. Now this contraction of atria will cause a heart sound, which is called as S4 heart sound. Now tell me, S4 heart sound is heard during which phase of cardiac cycle? It is heard during atrial contraction or atrial kick or atrial systole. Okay. Now after this, what is the next event? See, blood have got into the ventricles. Now blood is getting into the ventricles. Now let's come back to our chart. See, after atrial contraction, what should start? Now see, now it is the ventricle which have to contract. Atria are contracted. Now who have to contract? Atria should have to contract. Sorry, ventricle should have to contract. Ventricular contraction is divided into how many phases? 3 phases. So now let's start with the isovolumetric contraction, guys. Okay, now let's start with the isovolumetric contraction. See, blood have came down into the ventricles. Now blood is there inside the ventricles. Now, important point, sir. What is the pressure inside the aorta? See, the pressure inside the aorta is somewhere around 80 mmHg. Okay, the pressure in the aorta, when the ventricle is not contracting, it is 80 mmHg. Okay. Now, inside the ventricle, what is the pressure? Inside the ventricle, almost right now, okay, in the beginning, the pressure is somewhere around just 2-3 mmHg. You can technically take it as 0. You can actually take it as 0. Okay. The pressure inside the ventricle is 0. Okay, no doubt. Now, what is happening? Now, ventricle is now starting to contract. Okay, now ventricle is starting to contract. Now, just simple law, Boyle's law. When volume decreases, when ventricle is contracting, ventricular volume decreases. So what happens to the pressure inside the ventricle? The pressure inside the ventricle now starts to increase. Okay, now it's from 0 it's becoming 1, 2, 3, 4, something like that. Now, what happens? For example, if these valves, the mitral valve and tricuspid valve, if mitral valve and tricuspid valve, if they are open, what happens? Blood will regurgitate back. Do you want the regurgitation of blood? No, we don't want regurgitation. Okay, we don't want regurgitation. So immediately what will happen when ventricular contraction starts and ventricle starts to contract, immediately what will happen is there is closure of mitral valve and tricuspid valve. Mitral valve and tricuspid valve, they are going to be closed. So that will causes a heart sound. Which is S1 heart sound. Okay, that will cause S1 heart sound. Okay, that's the first important point I want you to remember. So S1 heart sound is heard during beginning of the isovolumetric contraction. Okay, so first heart sound occurs during beginning of the isovolumetric contraction. Now, why we are calling it as isovolumetric contraction? Why? Because see, the mitral valve is closed, even aortic valve is closed. Now itself, I just want to give you a clarity. Whatever the events which happens on the left side of the heart, same events will also happen on the right side of the heart. So let me discuss the events which are happening on the left side of the heart, so that you can understand same events, right side of the heart, left side of the heart, same events. Okay, now see, mitral valve is closed or not? See, this bicuspid valve, this is the bicuspid valve or mitral valve. Okay, it's a bicuspid valve or mitral valve. It is closed. Closing of this valve will cause the S1 heart sound. Okay, it's closed. Now what about the aortic valve? It is also closed. Why? Because in the aorta the pressure is 80 mmHg. Here the pressure is very less. Now heart is contracting. No volume of blood is coming in and no volume of blood is going out. There is no inflow of blood, no outflow of blood. All the valves are closed. So this is iso, means same. See, with the same volume of blood, the ventricle is contracting. No inflow of blood and no outflow of blood. So this is all isovolumetric contraction. Okay, please see here the rise in ventricular pressure. Okay, during the starting phase, whenever there is a rise in ventricular pressure, it causes the mitral valve, and tricuspid valves to close. That results in the first heart sound S1. Okay, now if you ask me what is the major purpose, sir? What is the major purpose of this contraction? Now ventricle have to contract. It have to increase the pressure. Okay, why it have to increase the pressure? Now whenever ventricular pressure becomes more than the aortic pressure, whenever the ventricular pressure, if it becomes more than the aortic pressure, then only aortic valve will open. Then only blood will move into the aorta. So what is the major purpose? The major purpose of this phase, isovolumetric contraction, is to open the aortic and pulmonary valve. Here aortic valve, on this side pulmonary valve. Okay, if you want to open the aortic valve, here how much pressure you have to generate? You have to generate pressure more than aorta. For example, if the pressure here is 80, you have to generate a pressure of 81 mmHg. Okay, something like that. So the major purpose of this phase is to open aortic and pulmonic valve. Now, once the pressure rises above 80 mmHg, here the pressure is 80. If the pressure here, if it becomes more than 80 mmHg, what happens? The aortic valve is going to open. Aortic valve opens. Now when the aortic valve opens, what happens? Immediately the blood from the left ventricle will start to go into the aorta. Okay, all this blood will rush into the aorta. That will cause a sound, which is called as ejection click. So opening of aortic valve will facilitate the movement of blood from the left ventricle into aorta. When the blood is moving very rapidly from left ventricle into aorta, it creates a buzz, it creates a sound which is called as ejection click. Blood is ejecting into aorta, that causes a sound which is called as ejection click. Okay, now tell me, sir, isovolumetric contraction ends with, important word is isovolumetric. No blood is coming in, no blood is going out. Okay, so it ends with what? Once this valve is opened, that's it, isovolumetric contraction is completed. Why? Because now blood starts to go out. So tell me, this phase ends by opening of aortic and pulmonic valve. Once the aortic valve is opened and once the pulmonic valve is opened, isovolumetric contraction is completed. Okay, now blood will move out. That's the ejection. Rapid ejection phase, slow ejection phase will start. Those are the next stages. Okay, so we have discussed important points about the isovolumetric contraction. During isovolumetric contraction, what happens? Pressure in the ventricle raises. When the pressure in the ventricle raises, what happens? Mitral valve, tricuspid valve closed, creating S1 heart sound in the beginning of the isovolumetric contraction. During isovolumetric contraction, what is the status of valves? All the valves are closed. No blood is coming into the ventricles, no blood is going out of the ventricles. Isovolumetric contraction, what is the purpose? To open aortic valve and pulmonic valve. What is the end of isovolumetric contraction? The end of isovolumetric contraction is opening of aortic valve and pulmonic valve. Completed. Now, what are the next phases, guys? See, now the next phase is rapid ejection phase. Please don't forget, the next phase is rapid ejection phase and slow ejection phase. Now, both these phases we will see in this one single slide. Let's start with the rapid ejection phase. See, ventricle is contracting. Now, in the ventricle, pressure became 81. Think, pressure became 81. Okay, pressure became 81. Immediately, what will happen? Aortic valve is going to open. Now, blood will rush into the aorta. That will cause a sound called as ejection click. The entry of blood from the left ventricle into aorta, this ejection of blood will create a sound which is called as ejection click. Okay, but important point is, see, the ventricle, the left ventricle is still contracting. The left ventricle is not going to stop. It is not going to stop at a pressure of 81. It will go to 85, 90, 95, 100, 110, 120. So, left ventricle is contracting and still generating a pressure up to 120 mmHg. So, here the pressure is only 80. Now, left ventricle is contracting and generating a pressure of 120 mmHg. So, blood will move out or not? Blood will move very rapidly. So, when the pressures are moving from 81 mmHg to 120 mmHg, yes, blood is going out. So, very fastly, blood is going out very fastly. This phase is called as rapid ejection phase. Now, they will ask you, rapid ejection phase is happening during pressure change from 81 mmHg to 120 mmHg. Most of the cardiac output, say most of the stroke volume, see 2/3 of the stroke volume, okay, 2/3 of the stroke volume is ejected out. But important point is, see, now ventricle starts to simply relax. Now ventricle is relaxing. Okay, now ventricle is relaxing, which means the pressure inside the ventricle is now falling down. From 120, it is coming down to 80. But still this is a higher pressure, right? 120 to 80 is also higher pressure. So as there is higher pressure here, now still some amount of stroke volume is going into the aorta. Okay, but slowly. This is called as slow ejection phase, SEP. Okay, slow ejection phase. So slow ejection phase is happening when the pressure is falling from 120 mmHg to 80 mmHg. Only a little amount of stroke volume, that is a 1/3 of the stroke volume, is now being ejected. Okay, so that's it. So this is the end of the slow ejection phase. First, isovolumetric contraction completed. After isovolumetric contraction, rapid ejection phase, slow ejection phase. Okay. Now, after this, what happens? The three phases of the systole are completed. Isovolumetric contraction, rapid ejection phase, slow ejection phase. Three phases of the systole are completed. Now, let's discuss about the phases of diastole. How many phases are there in the diastole? Protodiastole, isovolumetric relaxation, rapid ventricular filling, reduced ventricular filling, and atrial contraction. Now, let's start with the protodiastole. Proto means the starting of the diastole. What is happening? Okay, diastole means what? Ventricle is relaxing, right? Ventricle is relaxing. Now, the pressure is falling from 80 mmHg to 79 mmHg. Now, what happens? So, the pressure in the aorta is 80. Now, when the ventricular pressure, when it falls from 80 mmHg to 79, what happens? The pressure in the ventricle gone down. The pressure in the aorta is more. So, immediately what happens? The aortic valve is going to be closed. Aortic valve closed. For example, think logically. If this valve is not closed, what will happen? There is more pressure in the aorta when compared to the ventricle. So, regurgitation will happen. To prevent the regurgitation, immediately the aortic valve is closed. So, the closing of valves is happening. So, during which phase? During protodiastole. This causes a heart sound called as S2. So, direct question. S2 heart sound occurs during. Okay, S2 heart sound, it occurs during protodiastole. In most of the books, S2 heart sound is seen during protodiastole, but in some books you will have a controversy that S2 heart sound is also happening during beginning of the isovolumetric relaxation. Okay, in some books it was written, but the most authenticated books, okay, most trustable sources will tell you the closing of the aortic wall, produces a heart sound called as S2 heart sound. It is produced during protodiastole. Now, if someone comes to you and asks you, what is protodiastole, sir? Ventricle is relaxing. The starting of the relaxation, ventricle is relaxing. The pressure is now falling from 80 to 79. When the pressure moves from 80 to 79, immediately aortic valve closes. The closing of the aortic valve will cause a sound called as S2 heart sound. So, S2 heart sound is produced during protodiastole, that's it. Okay. So, the first stage of ventricular diastole where ventricular pressure falls from 80 to 79. When ventricular pressure becomes less than the aortic and pulmonic arteries, semilunar valves are going to close. What are the semilunar valves? On this side aortic valve, on this side pulmonic valve. So, closing of these valves at a time will cause S2 heart sound. That's it. Now, after this, what is the next phase? It's isovolumetric relaxation. Whenever you listen the word isovolumetric, same volume, nothing is coming in, nothing is going out. So, all the valves should be closed. See, here the mitral valve is closed. Here the aortic valve is closed, tricuspid valve is closed, pulmonic valve is closed. Forget about the right side, only concentrate on the left side. Now, what is happening? Please concentrate. Now, the pressure is now rapidly falling. Now, from 79 to 70, 70 to 50, 50 to 30, 30 to 10. Now, the pressure inside the ventricle is falling like this. Okay, ventricle is relaxing, pressure is falling. So, isovolumetric relaxation. What about the valves? See, both atrioventricular valves, these are the atrioventricular valves, tricuspid valve and mitral valve. Both atrioventricular valves and semilunar valves. What are semilunar valves? Aortic valve and pulmonic valve. Both atrioventricular valves and semilunar valves are closed now. What is happening? Pressure inside the ventricles falls without any change in the volume. Without any change in the volume of blood, the pressure is falling, something like this. Okay, so this is isovolumetric relaxation. After protodiastole, we are having isovolumetric relaxation. Once the important point is, see, here, once the pressure, here, it will become again to 0, or once the pressure in the ventricle will become less than the left atrial pressure. The pressure inside the ventricles, okay, I am talking about the both ventricles. Once the pressure inside the ventricles, if it becomes less than the atrial pressure, now you will get it out. Now, what is the reason for the pressure in the atria, sir? See, during isovolumetric relaxation, do you know what happens? Now this atria are receiving the blood. Now the atria are receiving the oxygenated blood, especially the left atria. It is receiving the oxygenated blood from the lungs. All that blood is now coming and accumulating here. That's why I am just showing you here. See, all these waves. These waves are nothing but the blood, oxygenated blood. Now it is coming and accumulating here. Okay, so here some pressure will be there, right? Yes, some pressure will be there. Now important question is, see, during isovolumetric relaxation, what happens? During isovolumetric relaxation, there will be movement of oxygenated blood from the lungs to the left atria. Left atria is receiving the oxygenated blood during isovolumetric relaxation. Now, important point is, once the pressure in the left ventricle becomes less than the atrial pressure, what will happen? Immediately these valves are going to open. Once these valves are opened, that's it. Isovolumetric relaxation is completed. Why? Because valves are opened, new blood is entering in. So, important point is, once the pressure inside the ventricles falls below the atrial pressures, immediately what happens? Atrioventricular valves, they will open. Okay, they will open. So, this phase ends by, okay, isovolumetric relaxation ends by opening of atrioventricular valve, that is opening of mitral valve and tricuspid valve. Important point right now, see, whenever these valves are open, all the blood, okay, all the blood, it will fall down or not? All the blood from the atria, now they will come down, okay, they will come down, the blood will come down. So, that will cause a sound which is called as the opening snap. Whenever these valves are opened, blood from atria will fall down into the ventricles, that will cause a sound called as the opening snap. So, this phase ends by opening of the AV valves. Once the AV valves are opened, you will hear a sound called as a opening snap. Okay. Now, after this, what is even happening, sir? See, I have already explained to you. See, right now what we have discussed, isovolumetric relaxation. In the isovolumetric relaxation, the valves are not open. Okay, in the isovolumetric relaxation, these valves are not open. Everything is closed. What I am saying you at the phase ends by isovolumetric relaxation ends by opening of these valves. So see, now when the valves are opened, okay, when these valves are opened, see, blood is coming down into the ventricles. How much blood? 70% of the blood. Okay, 70% of the blood is now falling down into the ventricles. Now that falling of blood will cause a sound called as opening snap. So even without atrial contraction, all the blood which is accumulating in the atria, now 70% of the blood is falling down. Okay, so is this phase active or not? This is not an active ventricular filling, this is a passive ventricular filling. So this rapid ventricular filling, it's a passive, it is passive, not active. So that's why I have just shown here, opening of the AV valves leads to rapid filling of the ventricles. Okay, which is passive in nature, there is no contraction of atria. Okay, simply the blood is gravitating down into the ventricles, that's it. So that's why there is no contraction of muscle, there is no need of ATP. So that's why we are calling rapid ventricular filling phase is passive in nature. Okay, 70% of the ventricles are filling passively. Now the rapid inflow of blood vibrates all this blood which is coming into the ventricles. Now that is vibrating the ventricular walls and causes a third heart sound. Okay, causes a third heart sound, which is normally heard in the children, Okay, so third heart sound is happening when? The third heart sound is happening during rapid ventricular filling. During rapid ventricular filling, what is the heart sound that you are going to hear? The rapid ventricular filling is going to be, the S3 heart sound is going to be seen during rapid ventricular filling. Okay, now opening snap, the opening of these valves. Okay, the opening of these valves will create a sound. The opening of these valves initially, okay, the opening of these valves creates a sound called as opening snap, and the blood which is falling down into the ventricles will vibrate the ventricular valves and creates a sound called as S3 heart sound. Even if you forget about the opening snap, not a worry, S3 heart sound is important. S3 heart sound is heard during rapid ventricular filling. Okay. Now, after this, let's talk about the slow filling. Okay, after rapid ventricular filling, see, please follow our table. After rapid ventricular filling, what we are left with? We are left with the reduced filling or slow filling of the ventricles. Slow filling of the ventricles. Now, what is this, sir? What is the slow filling of the ventricles? Okay, see, slow filling of the ventricles, which is also called as diastasis. This phase is also called as diastasis. Here, the rate of ventricular filling declines. See, the valves are opened, opening snap. The blood is coming from the atria into the ventricles. The blood is moving from the atria into the ventricles. Okay, S3 heart sound is also okay. Now what happens? Now the blood is moving slowly from the atria. Blood is initially, when the valves are opened, very forcefully blood is coming into the ventricles. Now what will happen is there is very slow movement of blood from the atria into the ventricles. For example, think like this. See, 70% immediately it will come. Now some amount of blood will come directly. See, some amount of oxygenated blood is coming from the lungs. Okay, some amount of oxygenated blood is coming from the lungs, and that small little amount of blood is directly falling into the ventricles. Okay, that's a slow ventricular filling. The blood which is directly coming, okay, oxygenated blood which is directly coming via this pulmonary veins is now directly falling into the ventricles. It's not accumulating in the atria. So this is called as diastasis. Okay, where heart is not contracting. Okay, atria is not contracting, ventricle is not contracting, and there is not much blood flow. Okay, very slow, very little amount of blood which is directly coming from the pulmonary veins is now directly falling into the ventricles. Okay, so this phase is the best time to visualize the heart on echocardiography. What is the best time to visualize the heart on echocardiography? It's the diastasis, where there is least cardiac motion, Okay, so diastasis, which is also called as slow filling phase, okay, which is also called as diastasis, where the least cardiac motion is seen. Best time to visualize the heart on echocardiography. So after slow filling, okay, rapid filling is completed. Okay, please concentrate here. During rapid ventricular filling, 70% is filling. Okay, and during slow filling, like very less. Okay, it's hardly in ml. In slow ventricular filling, we won't even consider it. But atrial systole is going to contribute 30% filling. 70% filling is because of the rapid ventricular filling. 30% filling is because of the atrial systole. 30% filling is because of the atrial systole. Again, same events will continue. So we have completed systole as well as diastole. Now let's see all these events in one time frame. Okay. Now let's start with the systole case. Systole. Now systole is divided into how many phases? Systole is divided into isovolumetric contraction, rapid ejection phase, slow ejection phase. That's it. Systole is divided into isovolumetric contraction, rapid ejection phase, slow ejection phase. Now please see, in the starting of the isovolumetric contraction, when the ventricles are contracting, the pressure in the ventricle increases. So immediately who will close? The atrioventricular valves, the mitral tricuspid valve are going to close. So creating which heart sound? S1 heart sound. So in the beginning of the isovolumetric contraction, there is S1 heart sound due to closure of mitral valve and tricuspid valve, M1 T1. First heart sound, right? M1 T1. Okay. Now after that, at the end of isovolumetric contraction, now isovolumetric contraction, ventricle is contracting. Now isovolumetric contraction ends with what? Now ventricle is contracting, it is generating a pressure of 81 mmHg. Immediately which valves open? Aortic valve open, pulmonic valve open. When these valves are opened, blood is ejecting into the aorta. So this ejection will cause a heart sound called as ejection click. Okay, once these valves are open, there is rapid ejection of the blood. How much rapid ejection? Almost 2/3. Okay, 2/3 of the stroke volume is going to be ejected. Okay, during a pressure change of 81 mmHg to 120 mmHg. Now after that what will happen? There is a slow ejection. Slow ejection means 120 mmHg to, when the pressure is falling from 120 mmHg to again back to 80 mmHg, still blood is going into the aorta but slowly. So slow ejection phase. Okay, slow ejection phase is also completed. So with this, systole is completed. Now after systole, who is going to happen? Diastole is going to happen. Diastole is like divided into how many phases? So diastole is divided into protodiastole, isovolumetric relaxation, rapid ventricular filling, and diastasis, slow ventricular filling, and atrial systole. 5 phases are there. Now first phase is protodiastole. What is protodiastole, sir? When the pressure falls from 80 to 79. When the pressure falls from 80 to 79. Immediately who is going to close? Sir, immediately aortic valve and pulmonic valve closes. Aortic valve closes. So that will cause a heart sound. Second heart sound, sir. S2. Okay. So S2 is happening during protodiastole. But if in your exam, if there is no protodiastole, okay, there is no option of protodiastole, you can also mark beginning of the isovolumetric relaxation. S2 is heard during beginning of the isovolumetric relaxation. That's also true. Both statements are like true. Okay, depends on the options whatever is given in your exam. If there is protodiastole, mark protodiastole. If there is no protodiastole, go with the beginning of the isovolumetric relaxation. Okay. Now isovolumetric relaxation is happening. Now what is isovolumetric relaxation, guys? Now pressure inside the ventricle. Okay, all the valves are closed but ventricle is relaxing. There is no volume change. No volume of blood is coming, no volume of blood is going. Volume of the ventricle is relaxing, the pressure inside the ventricle comes down. Okay, so that is isovolumetric relaxation. After isovolumetric relaxation, once the ventricle is completely relaxed, what happens? Guys? The atrioventricular valve opens, the mitral valve opens, tricuspid valve opens. Now this opening of these valves will create a heart sound, opening snap. Okay, opening of these valves will create a sound called as opening snap. After opening snap, what will happen? Now once these valves are opened, atrioventricular, once these valves are open, the blood, 70% of the blood from the atria is going to fall down into the ventricles. That is rapid ventricular filling. Whenever rapid ventricular filling happens, what will happen? The 70% of the blood which is now striking the ventricular wall will cause the vibration of the ventricular walls, which will cause a heart sound, S3 heart sound. So that's why please concentrate this sound. Okay, S3 heart sound is heard during rapid ventricular filling. After rapid ventricular filling, what happens? There is a slow ventricular filling, okay, or the slow filling phase, which is also called as diastasis, will happen, where blood is the oxygenated blood which is directly coming from the pulmonary veins. Now it will directly fall into the ventricles, which is called as a diastasis. So diastasis is now happening at the end of the rapid ventricular filling. Diastasis happens after, diastasis happens after the rapid ventricular filling. After diastasis, again same thing. You have to see here, during rapid ventricular filling, 30% of the ventricles are filled. 70% of the ventricles are filled. Now during atrial systole, 30% of the ventricles are filled. During atrial systole, it will create a sound which is called as S4 heart sound. So this timeline is also important. Now after this, let's directly discuss about important points, guys. Okay, already we have discussed all these important points, but few important points are there. What is the end-diastolic volume and systolic volume? We'll discuss now. Sir, S1 heart sound is due to closure of mitral valve and tricuspid valve. During isovolumetric contraction, mitral valve, the atrioventricular valves, okay, mitral valve closes, tricuspid valve closes. Okay, in the beginning of isovolumetric contraction, that causes S1 heart sound. S2 heart sound. S2 heart sound is due to closure of aortic valve and pulmonic valve. When? During protodiastole, when the heart is relaxing, when the pressure comes from 79, from 80 to 79 during protodiastole. Okay, so closure of aortic valve and pulmonic valve. Completed, done. Now ejection click. Now ejection click is because of what? When the aortic valve, pulmonic valve opens, when these valves opens, blood will eject into the aorta and pulmonic trunk. That will cause a heart sound called as ejection click. Okay, that will cause ejection click. Opening snap. Opening snap is because of what? The opening of mitral valve, opening of tricuspid valve, opening of mitral valve and opening of tricuspid valve. Okay, after isovolumetric relaxation, at the end of isovolumetric relaxation, okay, when the ventricle is relaxed, the mitral valve opens, tricuspid valve opening of these valves will create a heart sound called as opening snap, opening of mitral valve and tricuspid valve. Now S3 heart sound is heard during what? S3 heart sound, which is also called as ventricular gallop rhythm. Okay, ventricular gallop rhythm is happening during rapid ventricular filling. 70% of the ventricles are getting filled during rapid ventricular filling. And S4 heart sound because of atrial contraction. S4 heart sound is because of the atrial contraction or atrial kick. Okay, is because of atrial kick or atrial contraction. Okay. Usually this S4 and S3, usually these heart sound, they are not usually heard. Okay, but whenever the atria are contracting against the stiffened ventricle in pathological conditions, you can hear them. In pathological conditions you can hear them, but usually they are not heard. Okay, now what is isovolumetric contraction? Important points about the isovolumetric contraction. Isovolumetric contraction begins with the closure of mitral valve and tricuspid valve. Am I right or not? See, please concentrate here. Isovolumetric contraction, it begins with S1 heart sound, closure of mitral valve and tricuspid valve. And isovolumetric relaxation. Okay, isovolumetric relaxation, as I have already told you, in some books it was given. See, please concentrate, guys. Isovolumetric relaxation is beginning with what? It is beginning with S2 heart sound. Okay, S2 heart sound is happening where? During protodiastole. So, very important point is S2 heart sound, it is happening during protodiastole. If the answer protodiastole is there, go with the protodiastole. Or you can also say S2 heart sound is heard during beginning of the isovolumetric relaxation. Okay, why? Because some books mention about the protodiastole and some books doesn't mention about the protodiastole. Okay, you can, both are true. Now, what is end diastolic volume and end systolic volume? You have to know this. Sir, end diastolic volume is the amount of blood or the volume of blood. See, volume of blood present in the heart at the end of the diastole. At the end of the diastole. See, now ventricle is relaxing. Now, when the ventricle is relaxed, it is filled with the blood, right? How much amount of blood it is going to be filled with? It is going to be filled with 140 ml of blood or 150 ml of blood. Okay, so ventricle is filled with some amount of blood. Before ventricular contraction or before ventricular systole, what is the amount of blood which is present is called as the end diastolic volume. Okay, so end diastolic volume is the amount of blood present in the ventricle at the end of the diastole. Means at the end of the relaxation, how much amount of blood is there in the ventricle? How much? 120 to 140 ml or 150 ml will be there. Okay, it's not like an exact value, the range 120 to 140 ml can be there or even 150 ml can be there. Okay, so some amount of blood is there before the ventricular contraction. That amount of blood is called as the end diastolic volume, which is also called as a preload. Okay, that's it. It's called as a preload. Why? Because the load on which the heart is working. This is actually load, right? For example, it is not 140 ml, it is 200 ml. Now there is more load on the heart. If you put 200 ml of blood in the heart, now ventricle have to contract more powerfully. So this is a load on the heart. The amount of blood which you are filling is actually the load on the heart, which is called as a preload. This is a preload, means ventricle is not yet contracted. So this is considered as a preload. So end diastolic volume or preload, they are one and the same. End diastolic volume or preload, they are nothing but the volume of blood which is present inside the ventricles before contraction of the ventricle. Okay. Now, what is end systolic volume? Okay, you put 120 ml blood or 140 ml blood. Now, ventricle is contracting, isovolumetric contraction, rapid ejection, slow ejection. So, blood gone out. Out of 140, do you think the entire 140 ml blood will go into the aorta? No. The entire 140 ml of blood is not going to enter into the aorta. Out of 140, maybe 80 ml or 90 ml will go into the aorta. Which means 60 ml or 60 ml or 50 ml of blood still there inside the aorta, inside the ventricle, right? Even after contraction, some amount of blood is all the time staying inside the ventricles. So the leftover blood inside the ventricle after systole is called as end systolic volume. The name itself is there, end systolic volume. At the end of systole, the amount of blood left inside the ventricle is called as end systolic volume. Don't confuse it with afterload. This is not afterload. Okay, preload is end diastolic volume. End systolic volume means the amount of blood left inside the ventricle at the end of systole. Okay, these are some important points I want you to know. What else you should know is, sir, please concentrate. Look at here, guys. Normally, during contraction of the ventricles, especially I am talking about the left side, right? Normally, left side heart generates more pressure. In order to pump the blood into the systemic circulation, it have to generate more pressure. Heart have to pump the blood till to the tip of your toe. Systemic circulation. This is all systemic circulation. But there is something called as the pulmonic circulation. Heart is sitting over here. The right-sided heart, what is the function? It have to send blood to the lungs. Heart is here, just lungs are here. So, does it need to generate 120 mm Hg pressure? No. During systole, the right side heart will generate a pressure of 25 mm Hg only. Okay, 25 mm Hg. 25 mm Hg pressure. Okay, so this is the important point I want you to know. Left-sided heart will generate a pressure of 120 mm Hg. Right-sided heart will generate a pressure of just 25 mm Hg. That's it. So, the reason why I have said you this point is because, sir, this question was asked, pulmonary artery hypertension. So, define pulmonary artery hypertension. Okay. So, if the pressure inside the pulmonary artery, if it is more than 25 mm Hg during systole, see in the pulmonary arteries, okay, let me show you here the pressure during systole is how much? See, during, I just forgot to mention one more point. Let me discuss here itself. Sir, see, if I ask you about the BP, what you will say? Sir, BP is 120 by 80. Okay, you will say 120 by 80. If I ask you, please explain what is this 120 by 80? Sir, 120 is systolic BP and 80 is diastolic BP. Will you explain or not? Sir, what is diastole? Diastole means relaxation. See, when the heart is not contracting, my question to you, when the heart is not contracting, what is the pressure inside the aorta? 80. So, that's why diastolic BP is 80 mm Hg. Okay, we are measuring the pressure inside the blood vessels only, no? So, when the heart is not contracting, what is the pressure inside the blood vessel? 80 mm Hg. But when the heart is contracting, how much pressure it is generating? 120. So, this 120 mm Hg pressure will also be transformed, the same 120 mm Hg pressure is also going into the aorta or not? The same 120 mm Hg pressure is now getting transported into the aorta also. So, during systole, if you measure the pressure here, during systole, what is the pressure inside the aorta? 120. Okay, that's why we say systolic pressure means when the heart is contracting, the pressure inside the blood vessels is also 120. Why? Because heart is generating a pressure of 120. That 120 pressure is now getting into the aorta, is now getting transported to the aorta. So, in the aorta there is 120 mm Hg pressure during systole, and during diastole there is 80 mm Hg pressure. Okay. Now, in the same way, here in the pulmonary trunk, okay, in the pulmonary trunk, okay, let me show you here. Here, normally during systole, I have already explained to you the right side heart, how much pressure it will generate? It will generate a pressure of 25 mm Hg. So, what is the pressure in pulmonary trunk during systole? 25 mm Hg. 25 mm Hg. Okay, during systole it is 25 mm Hg. Now, what is pulmonary artery hypertension? Pulmonary artery hypertension is a pressure in the pulmonary trunk more than 25 mm Hg. Normally, the pressure should be 25 mm Hg. If it is more than, pulmonary artery hypertension is defined as pressure more than 25 mm Hg during systole in pulmonary artery. Okay, this is the important point which I want you to know. After this, let's discuss a few important points about the low pitch heart sounds. We have discussed about S1, S2, S3, S4, ejection, click, opening, snap. We have discussed about so many things. Now, see the heart sounds S3, S4, which are nothing but the ventricular gallop rhythm and the atrial gallop rhythm. S3 is also called as, just other name. S3 is also called as a ventricular gallop rhythm. S4 is also called as the atrial gallop rhythm. And there is one more sound which is called as a tumor blob sound, which is seen in conditions like atrial myxoma. Okay, atrial myxoma. Atrial myxoma means this is atria inside which you are having a tumor. Okay, inside which you are having a pedunculated tumor. This tumor will move. It will move. Okay, it will move. It will cause certain vibrations. It will cause certain sounds. Okay. So what I am trying to put into your mind is, sir, all the heart sounds are high pitch heart sounds only. All the heart sounds are high pitch heart sounds only. But these heart sounds, S3, S4 and tumor blob sound, these are the only heart sounds in the medicine which you can only hear with the bell of the stethoscope. In the stethoscope we are having two sides, right? That big one, the big one is a diaphragm. The other side is a small side which is called as a bell. So if you want to listen S3, S4 and tumor blob sound, you have to use the bell side of the stethoscope. So low pitch heart sounds are going to be heard with the bell side of the stethoscope. What are they? S3, S4 and tumor blob sound. Tumor blob sound is going to be seen in which condition? Atrial myxoma. Okay, so whenever they want to ask this one question, like tumor blob sound, they will use this word. See, this tumor blob sound is a low intensity heart sound. These are the low intensity heart sound heard after opening snap. You know what is opening snap? Opening snap means opening of atrioventricular valves. Opening of atrioventricular valves. Once the mitral valve is opened, when the tricuspid valve is opened, blood is going to move from the atria into the ventricles. During that time, this pedunculated tumor, it will also move, it will vibrate. Okay, it's going to get hit with the mitral valve. It will cause low intensity heart sounds. So whenever you listen this word, low intensity heart sounds which are heard immediately after opening snap, it is nothing but the tumor blob sound which is seen in atrial myxoma. What is atrial myxoma? Atrial myxoma is a tumor. It's not a cancer. It's a tumor which is going to be seen in left atria. It's a pedunculated tumor which is originating from the interatrial septum. It is originating from the interatrial septum which is pedunculated in nature. If you want to remember one more point, usually this condition, atrial myxomas, are associated with the tuberosclerosis. There is a disease called as a tuberosclerosis. Those persons will develop these atrial myxomas. So with this, we have completed cardiac cycle. We have completed all the phases of cardiac cycles and all the important points are done. Hope the video is helpful. See you in the next video. Thank you.